to the Part 2 video series about improving diabetes management and outcomes, presented by Superior Health Quality Alliance. This recording was developed for healthcare workers with an interest in providing care to individuals with diabetes. This second video will explain type 2 diabetes and its prevalence. You may watch each video in order or based upon your interest. The objectives for this learning session are to achieve the following. The first is to understand the pathophysiology of type 2 diabetes and who is at risk. Second is to identify signs, symptoms, diagnosis, and treatment of type 2 diabetes. Type 2 diabetes is the leading cause of kidney failure and new cases of blindness among adults in the U.S. Diabetes is associated with an increased risk of cardiovascular disease and affects every system and organ in your body. It is also linked to non-alcoholic fatty liver disease and non-alcoholic steatohepatitis. In 2021, diabetes was estimated to be the 8th leading cause of death in the U.S. Screening asymptomatic adults may allow for early detection, diagnosis, and treatment with the ultimate goal of improving health outcomes. This means that upon diagnosis of diabetes, individuals need to start testing and monitoring for kidney health, as one example. So who is at risk for diabetes? Well, the elderly are very much at risk. Obesity is a common risk factor, especially if your BMI is over 25. Women with polycystic ovary disease or those who have had gestational diabetes are always at risk. 45 years of age or older, because the older we get, the more likeliness that we will develop diabetes. Having a first-degree relative, so a sibling, parents. Having a sedentary lifestyle. If you have a non-alcoholic fatty liver, and based on your ethnicity. So how do we screen for type 2 diabetes? A1C is a very common test used, and this will give you an average of your blood sugar levels over the past 90 days. Next is the fasting glucose test. This is often done during physicals. Fasting glucose should be 126 milligrams per deciliter or below. Random blood glucose levels. These can be checked at any time. Urine tests. These tests can detect protein in the urine, which may indicate kidney disease and diabetes. Signs and symptoms of type 2 diabetes. There are several, the biggest of which is frequent urination, where you feel the need to go every 10 or 15 minutes. Thirst and feeling extraordinary thirsty or having a very dry mouth is a big sign. If you're losing weight without even trying, this typically happens when your blood sugar levels are very high. Constantly being hungry, having blurred vision, numbness or tingling in the hands and feet, and several others as listed here. To define prediabetes, the criteria include a fasting blood glucose levels between 100 to 125 milligrams per deciliter. For pregnant women, the 2-hour 75-gram oral glucose tolerance test solution. The A1C test, the levels between 5.7 and 6.4 puts you at prediabetes. If your fasting glucose level is 126 or greater, you are diagnosed with diabetes, not prediabetes. There are many medications available, and they all work differently. Here are some examples. Insulin. Some medications help produce insulin or increase insulin production. Metformin is a common medication used to manage blood sugar levels. SGLT2 inhibitors and GLP-1 receptor agonists. These are a newer class of medications that work in different ways to control blood sugar. Sulfonylureas, another class of medication, can help increase insulin production. Diet and exercise are always a treatment way with prediabetes. All of these medications work in different ways depending on your regimen and what works best for you. It's important to match the medication with your specific signs and symptoms to manage diabetes effectively. In summary, here are some key takeaways from today's presentation. Diabetes is the leading cause of end-stage kidney disease and new cases of blindness among adults in the U.S. Diabetes is associated with an increased risk of cardiovascular disease, non-alcoholic fatty liver disease, and non-alcoholic steatohepatitis. Screening asymptomatic adults may allow earlier detection, diagnosis, and treatment with the goal of improving health outcomes. Medications work in different ways depending on your regimen and what works best for you. It's important to match the medication with your specific signs and symptoms to manage diabetes effectively. Here are some resources cited in today's presentation. If you have questions about this video series or others, please contact us at info@superiorhealthqa.org. Thank you.